holistic medicine is becoming more popular as a complementary approach to traditional, or they call modern medicine. It emphasizes preventive care by promoting lifestyle factors before the illness develops. Now, patient ask what the key component of holistic approach. The first thing that we are treating the whole body. As example, in my practice, I treat the entire person, not the illness or the symptoms. As example, in rheumatoid arthritis, in addition to treatment, I consider lifestyle factors such as diet, emotional and psychological, and sleep, in addition to exercise. So what about dietary modification? Several studies and American College of Rheumatology suggest that using anti-inflammatory diets such as Mediterranean diet can improve the disease activity and reduce the symptom of rheumatoid arthritis. In a study found for what they call higher healthy index score, which include dietary component, they found that it is lower if it's low, that the patient is less likely to develop systemic lupus erythematosus. Also, additionally, nutritional component such as we try to avoid some food, which what they call inflammatory food, such as processed food, and the sugar and fat. All this will increase the inflammation and increase the consumption of vegetable and fruits and omega-3. They found this is good for patients with rheumatoid arthritis or SLE. Researchers found that the exercise is very important to improve the symptom of autoimmune rheumatic disease such as pain and fatigue and quality of life. So also they found that it reduced the mental problem in the patient and the other factor like cardiovascular disease. They found that mindfulness and meditation and cognitive behavior therapy, what called CBT, it's very important to use it for improvement of patient with disease, rheumatoid or SLE or any rheumatic disease. And also they found that the treatment of this will decrease the anxiety and depression with the patient with chronic rheumatic disease. They found that that what they call our space is very important because about smoking, about toxins. They found that if you stop the smoking, your disease activity will be less than before. Good sleep is very important for patients with autoimmune rheumatic disease because when I give patient like natural or herbal medicine, I found that the patient is much improved. They said just when my sleep is become good, now I'm all right. I mean, you see how the sleep is affect the activity of disease. They found that toxins in our what they call health space, that toxins like toxins or smoking or any gases, fumes, this could affect our health. So they found that stopping or help people to quit smoking, it could help for disease activity of autoimmune rheumatic disease. it's very important to look at this factor, because they found that stress could increase the activity of disease and could precipitate or develop autoimmune rheumatic disease. So it's very important for stress management by mindfulness and meditation and cognitive behavior therapy, what's called CBT. So what about non-drug treatment, what they call complementary therapy? I'm using low-level laser. What they found several studies found there is no difference between non-steroidal anti-inflammatory drugs and low-level laser therapy in treatment of patients with pain. Now, several studies found that there is no difference between non-steroidal anti-inflammatory drugs and low-level laser treatment when they use it in optimal dose. So therefore I am using this method, which low-level laser in acupuncture points, to treat my patient instead of using non-steroidal anti-inflammatory drugs, while what they call disease-modifying drug to start, as methotrexate, because methotrexate usually it takes time to start. So I am using low-level laser to give the patient relief until the start of this drug. So several studies and FDA found there is no significant complication for this device, and they said you can use it with in addition to therapy, what they call traditional therapy or modern medicine, like methotrexate or psilocybin or any other drugs, and you can use this one instead of using non-steroidal anti-inflammatory effect. So my method is more convenient than the standard laser therapy, because that instead of using 12 sessions, because in standard, now I try to reduce it to 1 or 2 sessions, and the pain improve from the first or second session. Now, my holistic approach integrates the modern medicine to complementary therapies, what I'm talking about, that sleep, that dietary modification, stress management, about exercise, in addition to low-level laser therapy for pain management. I found if the patient adhere to these, the patient will improve from the first session or second session. But very important that the patient stay with these things. Otherwise, patient is not to improve because he didn't adhere to these things.